Hello, I'm Shari Pfleeger. I'm the Research Director at the Institute for Information Infrastructure Protection, the I3P at Dartmouth College. And I'd like to welcome you to the second in our series of podcasts with I3P researchers. I'm here today with Dr. Kelly Caine, a research scientist at Indiana University. Welcome, Kelly.
Thank you, Shari. I'm really happy to be here. Thank you for having me.
Oh, you're quite welcome. So, would you like to tell us what you do at Indiana University, please?
Sure. My position is the Principal Research Scientist in the Center for Law, Ethics, and Applied Research in Health Information. And I also have an appointment in the School of Informatics and Computing at Indiana University, Bloomington.
But you're not a computer scientist, right?
I'm not. My training is in engineering psychology. I'm an engineering psychologist by training, and that's very similar to words like human factors or ergonomics or human-computer interaction. Those all mean the same thing. Basically, I'm a behavioral scientist who's interested in the interaction of technology and people.
So what do you bring to the I3P, and what interests you in being part of I3P and its projects?
Well, I'll start with the second part of your question first. What interests me is the overall mission and goal of the I3P to secure the information infrastructure of the United States. And I guess I think about that a little bit more broadly, just generally securing information infrastructure. And I think what I bring to that mission is the perspective of users and the perspective of a human factors psychologist who's interested in not only designing technology for technology's sake, but designing technology with the user in mind and understanding the way that people really think about technology and use technology in an everyday sense. With that knowledge, we can improve not only the technical side of the things that we design, but also the way that it works in the environment where people are always a part of the equation in some way.
So can you give us an example of how something might have been designed one way, but because of the kind of research you do, it was designed a different way?
Sure. So one project that I've worked on in the past is designing privacy-enhanced health technologies for older adults. So one problem that's been noted is that there are a lot of older adults who are living longer and longer, which is wonderful, but we'd like for them to be able to stay in their own home as long as possible. And they don't want to have to move to assisted living, and it's very costly if they have to move to assisted living. So we want to design technologies that can support them to stay in their own home as long as possible. Some of the design work that I've done has demonstrated that we can enhance those technologies from a privacy perspective. So instead of designing technologies that would monitor people in their own home and be perceived as invasive by those older adult users who might have them in their homes, we can create the same kind of benefits in technologies in a privacy-preserving way. For example, by designing an interface that allows the older adult to control the kind of information that's being collected about them at a relatively granular level. And even more broadly, even if the control is not present, they can see what kind of data are being collected about them. So that would be one example as a way we took the needs and abilities of the users into consideration when designing a privacy-enhancing technology.
That sounds great. So I can see how you bring that kind of expertise to the I3P's privacy project. What kinds of collaboration are you doing on that project, and how are your skills meshing with the other skills on the project?
Well, I'm working with I'd say I'm working with the whole team. I think that at the I3P, you've done a great job of bringing together a team that has a lot of variety in terms of discipline. So it's truly a multidisciplinary project. There are computer scientists. There's a sociologist that I'm working with very closely. My postdoc is a computer scientist by training, but he also has some expertise in human-computer interaction. There are legal scholars on the team. I kind of think of my job as getting the rest of the team to think about people and to bring the perspective of the users and really bring that perspective to all of the team meetings. The mesh has worked perfectly, so I haven't had any unlike some other projects I've worked on in the past, I've had to be a bit more aggressive in advocating for a user-centered or human factors approach. But in this project, the rest of the team has been very open to hearing the human factor side of things. And I think part of that is from the leadership of the project, and it was multidisciplinary from the beginning. And I think people who maybe weren't as interested in working on a multidisciplinary team or listening to other perspectives weren't involved from the beginning. So it's been very easy to really bring that perspective and work with people and mesh ideas very well.
That sounds terrific. This is exactly the kind of project that the I3P likes to do. We like to bring people together from different disciplines to tackle hard problems and come up with realistic solutions. So the nature of your work in general is multidisciplinary, judging from the name of your center. So it might be nice for our viewers to hear what your center does, because after all, it's your institution that's the member of the I3P, not just you personally.
Absolutely. Well, I feel really lucky to be at Indiana University. It's one of the reasons that I wanted to be at Indiana is because they really embrace multidisciplinary research, and I have a passion for multidisciplinary research and have always been involved in it during my time at Georgia Tech, and then also in my time in industry and in my time at Indiana. All the places I've been at, I've really supported that, and I feel like it's crucial for making headway in the kind of research problems that I'm interested in. So I'm interested in privacy, I'm interested in health, and I'm interested in technology, and the intersection of those three things. And to break ground in that area, you can't just have a physician be a physician by yourself. You can't just be a human factors person by yourself. You can't just be a technologist by yourself. You really need to have a lot of disciplines coming together to solve these big problems in the areas of health, technology, and privacy, which is really the core of my research. So Indiana really supports that. I work with amazing colleagues in the School of Informatics and Computing, like Apu Kapadia, who's also a member of, also one of the representatives, I3P, Gene Camp, Kay Connolly, and just a slew of other people that are really amazing to work with. The center where I'm principal research scientist is relatively new. It's the Center for Law, Ethics, and Applied Research in Health Information, or CLEAR. Mm-hmm. And that fits in pretty well with the mission. We want to make health information clear, and we want people to understand what information is collected about them, and also have that information go to really good use. You know, we all think of health information as being very, very private. But there's another side to it, that health information is incredibly valuable in the sense that it can be used to help other people. And so while we have privacy concerns about it, we also have this desire to help our fellow humans. And so one of the goals of the center is to find ways to both preserve the privacy of individuals in terms of their health information, but also make that health information useful in a broader sense to help the population at large. So in that role at the center, I've been involved in a few projects already. One I'll highlight is with Regenstrief Institute, the IU School of Medicine, both in Indianapolis. So it's a collaboration with them. We're working with a team of computer scientists, informaticians, ethicists, and I'm representing the human factors portion of that work. And the goal of that project with electronic health records overall is to create disparate data elements within the electronic health record so that users can separate those different pieces of information and then have access to them through a web-based interface, and then also potentially be able to decide which pieces of health information go to different healthcare providers. So again, that incorporates this idea of fair information practices, which has a number of different principles, and up to this point hasn't been the case. So if you have an electronic health record right now, you may have access to some pieces of it, but other pieces you may not. And you certainly don't have any control over where that health record goes if you see a new practitioner of some kind. So our goal is really to think of different models where you might have more control over it. Now, working with the ethicists is really great because they bring a whole different perspective, which is if we allow people to have very granular control over their information, how will that affect their own health, and how will that affect the privacy of the healthcare providers, of the physicians who may be taking notes, and if a patient's going to get access to those notes, how does that affect their privacy? So it's really quite complex, and that's why it's great to have this huge multidisciplinary team to work with.
Great. It sounds very exciting. And I'm sure our viewers look forward to hearing from you again when you can report on the results of some of these projects.
I'm looking forward to it.
Thank you very much.
Thank you.